In 2014, Brittany Maynard was diagnosed with a very aggressive and terminal brain cancer. She underwent lots of treatment and surgery, but the cancer continued to grow. With months to live and a determination to avoid the agonizing death that cancer would inflict, she moved to Oregon to have access to the Death with Dignity law. Unfortunately, her state of California did not have access to that law. In her final weeks, Brittany raised awareness in the aid in dying so that people like her would also have access to the end-of-life option. On November 1st, 2014, Brittany Maynard passed gently, consuming her aid in dying medication surrounded by her loved ones. Today I'm going to tell you why assisted suicide should be legal in all 50 states of America. Every day, millions of people are suffering from illness, and there's no cure for it. A lot of people are dependent and helpless, and there's nothing else for them to do. Because so many people are suffering with illness, they are drowning in medical bills. Thousands of money is spent by their families to help them stay alive when there is no cure for their illness. Dartmouth Institute for Health Policy and Clinical Practices Atlas Project reports an average cost of care to a patient that is terminally ill during their last 2 years of life is between $35,000 and $90,000. A 60 Minutes report, The Cost of Dying, reports that Medicare paid $55 billion for the final months of life for terminally ill patients, and only 70 to 80% of that made an impact of the person's life. That is a very low percentage for someone that is paying so much more money to keep someone alive. Death can be a very peaceful experience, but for someone who is suffering terminal illness, it can be very uncomfortable and very painful. And there is no way to get relief from this pain. It is also very difficult for your families to not have to know when the last time they're going to be spending with their loved one is. You are not only suffering, but your friends and family are also suffering. Now, what is the cause of all these people suffering? Terminal illness. The two top contenders of terminal illnesses are heart disease and terminal cancer. Heart disease is a leading cause of death of men and women every year. Coronary heart disease is the most common, and about 610,000 people in the United States die every year from heart disease. Cancer is the second most common cause of death in the United States. According to cancer.org, 1,658,370 new cancer cases are expected to be diagnosed this year, and out of that number, about 589,430 are expected to die of cancer, which makes that 1,620 people a day. Life.org describes that the diagnosis of terminal illness is a life-changing event not only for the patient, but for the patient's family as well, and can trigger feelings of depression in both patients and loved ones. The solution to all these problems is legalizing assisted suicide in all 50 states. Assisted suicide is the suicide of a patient suffering from an incurable disease affected by the taking of lethal drugs provided by a doctor for this purpose. In the United States, only 5 states have legalized assisted suicide: California, Oregon, Montana, Vermont, and Washington. Assisted suicide is not just giving up on your life. It is a very difficult decision that the person has to make, and they spend a substantial amount of time thinking about it. They also talk it over with friends and family to decide what they think is the best option for their own life. Assisted suicide can relieve extreme pain, and the states that have legalized assisted suicide have laws that you must be diagnosed with the terminal illness that leads to your death in 6 months or less. Assisted suicide can also give you a very pain-free and peaceful death. You can also be surrounded by your loved ones. You're able to say goodbye to your friends and family, and you won't ever have the guilt of not ever saying I love you for that last time. Although it is still a very difficult experience to lose your loved one, it helps knowing that your family member has not passed away in pain. Another benefit of assisted suicide is that it helps medical funds for others. A survey in Oregon said that 66% of cases that a patient requested assisted suicide is because they did not want to be a financial burden on their loved ones. This is the second most important reason for assisted suicide. Another benefit is that we can transfer these wasteful funds back to programs that have higher efficiencies. The Medicare can save $55 billion and help the healthcare funding. Usually when people have, there's so many people with terminal illnesses that there's usually a shortage of beds and nursing staff. A lot of people are very opposed to assisted suicide, and one of them is because of their religious beliefs. Some religions believe that anyone who commits suicide thinks that you'll go straight to hell. I understand that assisted suicide is not for everybody, but why not should we give the option to everybody? Why take away that choice for someone who feels opposite just for your believing? In conclusion, assisted suicide, every year, millions of people are suffering from terminal illnesses, and the only way to put them out of their misery is assisted suicide. Just take Brittany Maynard, for example. She had to pack up her life and leave and go to a different state just because she wanted a peaceful death. Nobody knows what it's like to have a terminal illness except for the person that has it. Why should it be up to someone else to control your destiny? I would like to end with an aspiration that Brittany Maynard had before she passed. My dream is that every terminal ill American has access to the choice to die on their own terms with dignity. Please take an active role to make this a reality. Thank you. Yes.
You said California is one of the states that are now legalized.
It is now legalized.
Or was it legalized when she was...
No, I think she raised awareness for it. Now more states have legalized it.
Good to know.
Wow.
I saw on the one map that you had, was New Jersey one of the states that was considering it? Was it like in the shaded light green?
They were considering it.
And where are we, do you know where we are with that process? Are we close or what's happening?
Legislation.
Yeah.
I think we are considering it, but I think as of now it's still considered second-degree murder.
Right.
Any other questions?